Good evening once more, and welcome to our Womb Care Clinic webinar, where we'll be talking about PCOS. Can somebody please confirm if I'm audible?
Loud and clear.
Thank you very much. Welcome once more. And today we'll be talking about PCOS. My name is Dr. Mweemba Musoba. I'm a consultant obstetrician and gynecologist at Womb Care Clinic. I'm also a fistula surgeon and I'm a fertility fellow. September is PCOS Awareness Month, and as Womb Care Clinic, we decided to join in the world even as we get to raise awareness concerning PCOS by having a discussion about this complex medical condition that is affecting a lot of women out there. Please note that this session is for learning and awareness purposes only. And for your own personal medical care, please make sure that you consult your healthcare provider. I decided to use this particular picture. Why? Because with Polycystic Ovarian Syndrome, this is actually a disease that is cross-cutting among different groups of people from different ethnicities and different backgrounds. It is a non-selective disease and it affects women almost quite equally coming from different backgrounds. So this is my presentation layout. I'll start with a common case that I find in my gynecology clinic. And that is you get a 28-year-old female who comes in because her and her husband have been trying to have a baby for the past 2 years. She is absolutely frustrated and convinced that she is the one with the problem. And the reason behind that is because her periods have always skipped from the time that she started having them. She's never told her husband about this. And when she actually does have the periods, they seem to be very heavy. And she also reports episodes of having to constantly shave her chin because she's got hair that grows in that area. This and many others point to just about a case of polycystic ovarian syndrome, with some features being present in some women, with other features being present in other women. But basically, you get this type of a clinical case scenario with women coming to the hospital seeking for help. Why? Because one, maybe they want to get pregnant. Number two, because their periods have been irregular. So what is PCOS, or polycystic ovarian syndrome? Or as it's called by others, polycystic ovarian disease. So this is a very complex disease process which involves your endocrine system, and your endocrine system is the one that deals with the hormonal aspect of a woman, and it usually affects women of reproductive age. So it affects a woman's metabolic. And when we're talking about metabolic, we're simply trying to talk about how the woman processes all the nutrients and foods that she takes. And it also affects the woman's reproductive function, and that is her ability to have children. So this is a disease process that usually starts in its adolescent stages. So we know that adolescent is that period of time where there's a lot of transitions that is happening in a woman's life, in a girl's life, even as she's becoming a woman, with a lot of changes in her bodies and even in her hormonal aspects. And you find that the symptoms that are associated with polycystic ovarian syndrome are ones that will fluctuate over the duration of a woman's reproductive period. If you look at some of the facts that are surrounding PCOS, you find that it affects about 6 to 13% of reproductive aged women. It also has about 70% of the affected women worldwide remaining undiagnosed of this particular disease. So it means 70% of women that are actually suffering from PCOS are going out there not knowing that they have PCOS. The diagnosis is not being made. PCOS is the commonest cause of anovulation, which simply means not being able to produce eggs as a woman, and is a leading cause of infertility. And when it comes to PCOS, it is actually associated with a variety of long-term health problems, such as heart disease, such as hypertension, such as diabetes, which might affect the woman physically and emotionally. PCOS is also something that is hereditary. meaning it runs in the family. Studies have shown that 25% of women that are actually suffering from PCOS are coming from a PCOS mother. So it means even women that have got polycystic ovarian disease have got the ability to have children. However, you find that the risk in those children that they have, 1 in 4, might end up developing PCOS. So, what are the signs and symptoms of polycystic ovarian disease? So, when it comes to the signs and symptoms of polycystic ovarian disease, the major thing that brings a lot of women to seek a consultation concerning their health is that they have what we call menstrual irregularities. And when we're talking about menstrual irregularities, we know that the menstrual cycle has got a specific period of time. And I think, just as a point of note, whenever you're asked by your clinician, your gynecology, when was your last menstrual period? What is being referred to is when was the first day when you started bleeding. So in the medical terms, that's what we call a menstrual period. And when we ask when was the last one, that's exactly what we're talking about. So if you look at menstruation in particular, when you talk about normal menstruation for some women, menstruation will come between 21 and 35 days. I get a lot of women that come to the clinic who keep on saying they're having irregular menses. And when you do follow their calendar properly, you find that they're having at least one menstrual cycle between 21 and 35 days. And when you follow it quite well, you find that on average, most women have got a 28 to 30-day cycle. So that is what you call normal menstruation. And when it comes to the menstrual flow itself, you find that a normal menstrual flow will last between 2 and 7 days. Others put it between 3 and 7 days. Anything lasting more than 9 days is considered to be abnormal or heavy. So when it comes to women that present with menstrual irregularities, you find that 75 to 85% of the women that are suffering from PCOS actually come through the clinic. Why? Because they are having menstrual dysfunction, which means a woman can go up to more than 35 days without seeing her periods, which is quite alarming to a woman and which is quite alarming when it comes to health-wise. Sometimes some women can go up to 3 months without actually even seeing their periods. So when we talk about that irregularity, we're talking about these very rare forms where you're having your periods. In a year, you're having less than 8 periods, which is quite worrying, and this is something that should make you seek medical help. So why is it that women with polycystic ovarian disease have this menstrual dysfunction? The major reason why is that women with polycystic ovarian disease usually do not ovulate. What controls a woman's menstrual cycle, to break it down to its easiest point, is that there are two hormones, which is estrogen and progesterone. With estrogen being the hormone that causes the inside of the uterus of a woman to thicken, whilst progesterone is the one that is produced after ovulation has taken place and causes that inside of the uterus to become more stable, to receive better blood vessels, and to prepare for pregnancy to happen. Now, because there's no progesterone being produced and because there's no ovulation, therefore there'll be no progesterone, what you get to have in these patients is that they become predominantly estrogen dependent, meaning the inside of the uterus just becomes very thick. And because of that, they do not have their menstrual cycles because it is a withdrawal of progesterone that actually causes one to have their menstrual cycles and to have their menses in general. And you find that these particular women, if one is suffering from PCOS, you find that when the periods actually do come, they come as very heavy periods that will last more than the average 7 days that is supposed to be for, with women complaining about having their periods lasting even up to 2 weeks, even some going as far as 3 weeks in terms of bleeding because the uterus is just shaded. So you have those aspects where a woman has got menstrual irregularity, and because of that, she gets to seek medical help. So if you look at the way we're talking about the menstrual irregularity, you find that when a woman starts having her menses, as she's a young girl who's just reached menarche, the period when she starts having her menses, you find that during those first 5 years of one starting their periods are usually quite irregular, and you can go more than 40 days without having your period. That's why when it comes to diagnosing PCOS in the adolescent period, it becomes a little bit more difficult difficult. Why? Because this is also a time when there's a maturation that's happening in the brain, affecting your ovaries and affecting your uterus as well. Weight gain and obesity. So the World Health Organization defines obesity as an abnormal or excessive fat or adipose distribution that puts one's health at risk. And with patients that have got polycystic ovarian disease, you find that they've got this tendency of having weight gain. So somebody just easily gains weight and moves on to the obese side of things. And it's a type of weight that is not very easy to shed off. So despite, one saying I'm going on a diet, when they add a bit of exercise, you find that they're still having a struggle to shed off that weight, but they're still managing to shed off that weight. So you find that obesity and weight gain actually affects more than 75% of patients that are suffering from PCOS. Fat is a very dangerous thing in one's body. In particular, the fat distribution that women that have PCOS have is even much more dangerous because this is fat that begins to surround your internal organs. So this fat that surrounds your internal organ is one that breaks down quite easily and causes a release of so many toxins into your system. And these toxins into your system begin to injure vital vessels, begin to injure vital organs, and start leading to the other complications that follow women that have got obesity and that have got PCOS, such as hypertension and heart disease. So you find that there's this abnormal distribution of fat, more especially in the gut area, for patients that have got PCOS that is not very easy to shed, and this also propagates the disease process. So how do you measure this obesity or fat aspect of things? So there's what we call the body mass index, which is an easy calculation that anybody can do at home. It's simply your weight in kgs divided by your height times 2 in meters. So that is what you call your body mass index. And when it comes to body mass index, you find that a body mass index of above 25 is considered to be overweight, and above 30 is considered to be obese. So the higher you go in those particular numbers, the higher the risk of various complications that might come through. So you find that the other method in which obesity is measured is through your waist circumference. And if you've got a waist circumference of more than 88 centimeters, that is obese. And if you've got a waist to hip ratio of more than 0.8 centimeters, that is considered to be unhealthy. Hair growth and skin disorders. So with patients that suffer from PCOS, they get to have a lot of abnormal or male pattern-like hair growth. And this is hair that grows, which is coarse, mature hair, if I can put it that way, that grows around the face, it goes upper lip, it goes on your chest, your back, it can go on your upper abdomen, that's like below your belly button, above your belly button. For some, it can grow on the legs and the inner thighs. So you find that generally patients can be quite hairy. So it doesn't mean hairs should be all over your body to actually be classified as male pattern-like hair growth. But these hairs can be growing on certain parts of your body to a point whereby you constantly have to shave them, you constantly have to use hair remover, or maybe even have to go for some sort of laser surgery to actually have them removed. So hirsutism is the medical term that talks about this particular growth, coarse hair, which grows in a male-like fashion in females. And it is one of the common symptoms which affects about 75% of women that actually have PCOS. And you find that this hair growth is actually worsened as one begins to gain weight. So you find that the same weight gain that we're talking about also plays a role in this excessive hair growth that one can have. And also due to an increase of hormones such as testosterone in the female, in those that have got PCOS, you find that about 5% of women will end up losing hair. So they have what we call male pattern baldness, where you start losing hair from the top of your head, the back of your head in these particular places. Also, skin problems are something that is very common in terms of acne. And you find that acne affects 15 to 30% of patients, more especially those who are in their mid-20s going to their 30s. As one is maturing and going through that adolescent phase, you find that, of course, we do undergo those changes where you start getting pimples and all of that. But with this particular acne, this is acne that persists even after that adolescent period. This is the type of acne that requires that you get some medication. And despite using, for example, different type of skincare routines, you find that it is persistent. And why? Because this is hormone dependent. And in particular, it's a lot of male hormone dependent type of acne. Then there's what you call acanthosis nigricans, which is just basically where there are dark patches within one's skin, more especially in the areas where the skin folds a lot. So in the neck, in the armpit, in the groin area, where you find that a patient develops very dark, velvety, shiny type of patches. And all these are due to an increase in hormones that are there in your system, and those cause the skin changes that are there. Infertility. One of the major reasons why women with PCOS actually visit the doctors. You find that for most women, they would go through their adolescent stage, their young adulthood stage, without having concern so much about their periods because maybe they think they cannot do much about them. But when they finally do settle down and they get married or they find a partner who to say, I want to start a family with this person, that's when the biggest concern actually comes into play. Why? Because we know that the menstrual cycle and a regular, healthy menstrual cycle plays a critical role in how one can actually have a child. And if you're having your cycles, once every 3 months, it doesn't give you the best of chances for you to actually conceive naturally. So when we're talking about infertility, we're simply talking about the inability to conceive following 6 or 12 months of frequent unprotected intercourse in a couple. And we put it at 6 months for couples that are above the age of 35 and 12 months for couples that are less than the age of 35. So infertility affects about 70% of patients that have got PCOS. So you note that it doesn't affect 100% of all patients because even when some women actually get to have their periods, it is possible for them to have ovulatory periods where an egg is actually produced during those cycles, and it is possible for them to get pregnant even at that point in time. But you find that for the vast majority, 70%, they're actually affected by infertility. And the major reason why the infertility is happening is because of what I was explaining when it comes to the menstrual cycle. Because the menstrual cycles that women with PCOS get to have are anovulatory cycles with no production of an egg. And because there's no production of this egg, because of the high androgen, which is like male-like hormones such as testosterone that are present within the ovaries themselves, these cause the little bubbles where the eggs are supposed to grow for them not to mature or grow properly. And therefore, if they do not grow, they do not reach a size where they can actually get to ovulate. And either ways, this toxic environment that is there in the ovaries as well causes sort of an unhealthy egg production that can happen in case ovulation does happen. So you find that the majority of the patients that do not get to have babies or that get to suffer from infertility suffer from what we call an ovulation dysfunction, meaning there is no egg that is coming out. And therefore, if there's no egg, it means the sperm cannot meet an egg and fertilization cannot happen. So, how do I know if I have PCOS? That's a very important question. So, a diagnosis of polycystic ovarian disease or polycystic ovarian syndrome starts with the symptoms that I just previously talked about. So, a woman has to know what is going on with her body. So those symptoms are very important, that even when you go to the doctors for your evaluation to say, I think there's something wrong with the bodies, the questions that the doctor is going to ask are going to be directed towards those particular symptoms. Of course, there will be other questions that will be asked because there are other hormones that actually get to contribute to healthy ovulation, to healthy periods as well. So when you ask these questions, are your cycles regular? How many cycles in a year do you have? When your periods do come, how long do you get to bleed for? Do you have an unusual growth of hair on your body? How is your weight? Do you struggle with weight gain or weight loss? Have you been struggling to have a baby? All these questions will be asked of you and so many others. Then blood tests will be ordered, and these blood tests that are going to be ordered are just to understand the hormones that are actually responsible for what you're going through. So the testosterone, you find that hormones that deal with your egg reserve will also be ordered for, and other hormones that contribute to your menstrual cycle will be ordered for. And a physical examination will be done as well. Remember, I did say there are issues of hirsutism, which is abnormal hair growth. There are issues of acne, which your doctor needs to evaluate on your body. And also because of the central obesity or the weight gain that is there around your belly area, that is something that your doctor will also get to examine. From the medical point of view, we look for 2 out of 3 of the following to make the diagnosis of what? PCOS. And that is number 1, irregular menstrual periods, which we've already discussed. Number 2, evidence of high levels of androgens. So androgens are more like, sort of male hormones in your system, which might lead to excessive hair growth or loss of hair, which might lead to acne, or also through blood tests as well, that we get to see these particular hormones that might be high in your system. And then finally, an ultrasound is done. The most preferred ultrasound is a transvaginal ultrasound. Why? Because this ultrasound brings the uterus as close as possible to the probe, which makes the uterus as close as possible in terms of the imaging that we get to see. And when we get to look at the scan, usually, what we get to have is an ovary that has got a lot of bubbles around it, and also an ovary that has got an increase in size. So if you have any 2 of these symptoms, usually that's when we make a diagnosis of PCOS. So how do you manage PCOS? So when it comes to managing PCOS, we've got specific goals that are necessary for one to meet. This is a very complex medical disorder, meaning some parts of it sort of overlap. And when you're trying to manage one side, you find that you might do damage to the other side. So I'll explain this a little bit later when it comes to infertility in particular. So you find that some of the major goals in managing PCOS are: number 1 is to eliminate or lessen symptoms associated with androgen excess. So if you're having acne, hirsutism, which is the abnormal hair growth, our goal is to reduce those features so that one's confidence can actually be improved. Number 2, to regulate your cycles. Remember, you are only having levels of estrogen that are causing the inside of your uterus to become thickened, and your inside of your uterus shades in such an infrequent manner. This has been shown to put women at risk, those who've got PCOS, at risk of them developing endometrial cancer, which is the cancer of the inside lining of the uterus, the one that gets to break down when you're having your periods. So it is also to improve metabolic symptoms. Remember, there's a metabolic dysfunction that happens with PCOS, meaning your body does not get to process the nutrients properly. So patients that have got PCOS also have what we call insulin resistance. Insulin is the major hormone that causes or that regulates your sugar levels within your system. So if you've got insulin resistance, it means you've got very high sugar levels in your body, despite your body producing what? Insulin. And these high sugar levels can actually lead to a complication that I'm sure we all know about it, which is diabetes. So that is something that needs to be controlled in your body to make your body more sensitive to insulin so that you don't end up having diabetes and the complications that can follow diabetes, such as poor eyesight to blinding, kidney disease. Those are some of the complications that can happen. And also to achieve and maintain a normal body weight, because we know with a normal body weight, you've got reduced fat in your system. With reduced fat in your system, you've got a lower risk of having any heart problems or hypertensive problems. And for the women that are trying to conceive, you find that the goal is to return that fertility back. So how do you get to manage it in detail? Primarily, weight has been shown to be a huge contributing factor to almost all the symptoms or the problems associated with PCOS. So it is important that individuals that have got PCOS get to lose weight through a healthy lifestyle and diet. And we're talking about a healthy lifestyle, we're talking about exercise, avoiding a sedentary life, we're talking about reduction in alcohol, smoking, the fatty foods that we like, the super hungry lion on a daily basis. That is not something that is necessary. So we need to avoid all of this. And with a healthy diet where you increase your greens, you increase your water intake, you avoid the white carbs so much, and you sort of get to balance out your diet. Why? Because it has been shown that even just a 5 to 10% reduction in one's body weight has been shown to improve one's metabolic function, and even the reproductive benefits are actually there. So if somebody is suffering from PCOS and they're weighing 100 kg, just dropping to 90 kgs, you find that reduces the risk of you developing complications of high blood pressure, diabetes, and also improves your chances of ovulation. And for some patients, they do have a lot of difficulties in losing weight, despite diet, despite exercise, despite being strict, and you find that medications can be helpful for these particular patients. When it comes to abnormal menses, remember, we're saying estrogen is there, progesterone is not there. And therefore, because of the lack of progesterone, you find that the inside of the uterus is constantly thickened and only gets to shed off every once in a while. So how do you get to manage it? Medical management. And that is with hormonal contraceptives. These hormonal contraceptives can be progesterone containing or even combined hormonal contraceptives. Medications such as metformin have been shown to be useful. And when it comes to the non-medical aspect of it, we're talking about weight loss again, exercise, and diet. When it comes to infertility, one thing that is important, and it still comes down to the healthy lifestyle, and that is preconception, before you get pregnant, to actually lose weight. This is important. Why? Because once you lose weight, you find that studies have shown us that ovulation begins to take place naturally in the system, even without medication. And as well, it's important for one to lose weight. Why? Because going into a pregnancy with a very high body weight or with obesity, you find that has got its own complications with things such as hypertensive disorders, diabetes. There's a high risk of preterm delivery, and then there are also high risk of complications to your baby as well. Medications can also be used when it comes to infertility to help induce your periods, to help improve your egg production as well, and to just help support the inner lining of your uterus. Surgery was used in the past in managing patients with PCOS, and of course, there's IVF that is involved. When it comes to treatment of things such as acne or hirsutism, this abnormal hair growth, you find that hormones also play a role in this particular part. And you find that combined hormonal contraceptives have been shown to be useful. If they're not working, you find that one can add some other androgens or topical creams that can help with this. Shaving, hair removal, and laser surgeries are also helpful. There is, however, a relationship that comes in with all of this. You find that some of the medications that we get to use in order for us to manage, for example, acne or excessive hair, are medications that might be teratogenic, which means if one got pregnant and continued taking these particular medications, they've got a very bad effect on the baby who is growing in there. And that is why it's important that if you're on certain treatments that might be teratogenic and you do get pregnant, it's important that you book for antenatal care as early as possible so that these medications are stopped. And if you look at the way we're trying to balance out things, you find that somebody's having irregular periods, you put them on combined contraceptives, for example, these will definitely prevent you from actually getting pregnant. So that's why I say some of these treatments actually overlap. And as a woman that is suffering from PCOS, you need to have a discussion with your clinician to say, currently my goal is to get pregnant, or currently my goal is to have normal menses, or currently my goal is to get rid of this hair that I'm having. So please prescribe a treatment that will sort of match that particular goal. And because PCOS affects a lot of your metabolic function, which is the way you get to process a lot of your foods, and hence it causes the obesity that we just talked about, you find that it has got what we call long-term medical complications. And these are hypertension. So you find that high blood pressure is much higher in patients that have got PCOS. Diabetes in particular is also quite much more frequent in patients that have got PCOS. And that's why it's important that if you've got PCOS, you need to be having your sugars checked and you need to be going for screening every 3 to 5 years to make sure everything is okay with you. There is also an abnormal fat distribution within your system. Remember, we did speak about this weight gain, which is very difficult to shed off in some patients. That happens. So, with this weight gain, which is basically fat that is surrounding your internal organs, and which is very deadly type of fat, you find that because of this, you get a very high levels of unhealthy fats in your system, such as the LDL, and then you get very low levels of the healthy fat in your system, which is like the HDL. So you find that the ratio of the good fat versus the bad fat becomes totally deranged. And this puts you at risk at so many sort of vascular type of diseases. So it is important that you do twice yearly, at least, measurements of your fat levels to just make sure everything is okay, to check on your kidney functions, liver functions, just to make sure that things are okay. Then there's what you call sleep apnea, which is just basically a disturbance of sleep that can happen where somebody stops breathing at some point in time in their sleep. And that's where somebody starts snoring, or, where you hear a person just go like, as if they're choking or something like that. And you find that with sleep apnea, because of obesity, it is much higher in patients that have got PCOS. And most people do not even know they've got sleep apnea. Why? Because they do not realize it. But you find that they just wake up very tired, very fatigued. And if they're married or they're with their partner will tell them, you are snoring a lot, I had to kick you, I had to move you around, because they're developing these episodes of sleep apnea. Depression and anxiety is definitely a long-term side effect. These are people that have got, high facial hairs, they have to constantly shave, they go through acne, and with the society that we live in, where infertility is frowned upon, we need to have babies and somebody's not having a baby. So you find that all of this takes a mental toll on individuals and can lead them to depression and to have a lot of anxieties, because again, they do not know when their period will come. Am I pregnant? Am I not pregnant? So they live life with a lot of anxieties. Endometrial cancer. Remember, the inside of the uterus is not shedding, it's just very, very thick. And because of that, there's a high predisposition of those cells turning into cancer. So it's important that, like I said in the treatment goals, regulation of one's menstrual cycle is something that is very important to allow the inside of the uterus to keep on shedding periodically and reduce the risk of endometrial cancer. Women with PCOS can get pregnant. That is a very important message. It might be a difficult journey, but they can still get pregnant. However, patients who have PCOS who do get pregnant can suffer a lot of complications in their pregnancy. And that is why, if somebody has PCOS, it is important for you to book for antenatal care as early as possible and follow the instructions that your team clinician is giving you throughout your antenatal care. Some of the complications that have been seen in PCOS are miscarriages, can happen, gestational diabetes, which is a sugar that comes in pregnancy, pregnancy-related high blood pressure complications such as preeclampsia, eclampsia can also happen. We find that premature delivery, and they're also at high risk of cesarean delivery. They're at high risk of strokes as well. Why? Because of all this fat in the system causes injuries to the blood vessels, and because of these injuries to the blood vessels, you might end up having a stroke. And there's a higher risk of the newborn suffering death, either even in the womb or even after delivery. So it is important, just like I mentioned, for women that are on that fertility journey. Number one, reduce the weight. And even as you reduce the weight, you get to have a healthier pregnancy that might have less complications. So, while there's no cure for PCOS, there is hope. And with the right support, lifestyle changes, and medical care, symptoms can be managed. Fertility often can be improved and long-term risks reduced. If you're experiencing irregular cycles, difficulties conceiving, or other related concern, please know that help is available and you don't have to walk this journey alone. Thank you very much. That was my presentation on PCOS. I don't know whether there are any questions in the chat that we can take on, get to answer. Anybody who'd like to share anything concerning PCOS, leave it open. And if there's anything that you'd like to ask, I think that would be perfect so that we can just have a discussion on it. Remember, we're talking about 6 to 13% of women actually suffering from PCOS, and about 70% of them are undiagnosed. So, meaning a lot of women get to miss out on the opportunity of understanding what is going on with them. They think it is normal. They are told it is normal. You're just growing. You'll be fine. Keep waiting. And you find that for some women, they actually do delay in seeking help when it comes to fertility issues until they are far much older, which is quite a challenge. So if there are any questions, please just drop them in the chat. We can allocate 10, 15 minutes, depending on the number of questions, and I'll be able to answer some of those questions. Comment in the chat from Dr. Kefas Mwanza saying, Dr. Musoba and team, thank you so much for the insights and for the organizing this topic. Thank you very much, Dr. Mwanza. We appreciate your support. Rotis Phone says, thank you very much. Thank you so much. It was extremely insightful. You're most welcome. Siziwe says, a very insightful presentation. Thank you. You're most welcome. Ms. Amanda says, great presentation. Thank you for this platform. Can semaglutides and other related medications treat PCOS? Thank you very much, Ms. Mwonga, for that question. So when it comes to the semaglutides, this is some of the new medications that are on the market. And basically for these particular medications, these are sugar medications that are available. However, they've also been used for women who've got obesity with PCOS, and they've been shown to be very helpful in terms of weight management and weight loss. And remember, with weight loss comes an improvement of how your body gets to respond to the metabolic side of things, and also when it comes to ovulation. So short answer is yes, they can be used for weight loss, but that should be sort of a second option for women that are having difficulties in losing weight through exercise and lifestyle modifications. Kalua Thelma asks, what are the supplements one can take to reduce visceral fats and hirsutism? So when it comes to the visceral fat part of things, is that number one, it's important to exercise. I think I cannot overemphasize the lifestyle aspect of it. Even before we get to jump into sort of supplements, you find that the lifestyle part of it is something that is very important. And also in terms of what's there on the market, because of the insulin resistance that is there, you find that there are good studies that have shown that inositol, myo-inositol have been very helpful in reducing insulin insensitivity that patients get to have. And because of this reduction in the insulin insensitivity, what you get to have is that you've got better sugar control and a reduction in fat overall. And when it comes to hirsutism usually has a plan depending on the severity of it. You find that hormonal contraceptives combined have been shown to be quite useful in hirsutism. And if they're not working over a 6 months period, you find that androgens, other medications like spironolactone can be added, which is quite helpful. But please remember to always seek medical advice, even as you get to ask these questions, so that even as you go to speak to your practitioner, you get to tell them, okay, I've read this, I've heard about this. Can it help my condition? And I think those are the discussions that we're trying to bring forth. Hannah says, thank you, doctor. There's a comment that says, it was amazing. What are the chances of having a perfectly healthy baby without special needs, considering that eggs ain't as great? Thank you very much for that question, Hannah. I do not have the numbers in particular to say this percentage you mean you're going to have a healthy baby. But one thing I can tell you is that women with PCOS, once there is a control of that androgenic environment, the high level testosterone environment that is there within the ovaries, they get to ovulate well and they get to have a healthy resumption of their ovulation to a point that they actually get to have healthy babies. So it's important to know that with the management of the weight, with the management of that high androgen area, you find that ovulation does resume. And with the resumption of ovulation, healthy eggs can be ovulated, and a healthy pregnancy, healthy baby can actually be had. Alfonsina asks, what can be done about the baldness? So in terms of the baldness that actually gets to set in, this is due to very high levels of testosterone that are there in a patient. And you find that if you're going to manage this particular baldness, you need to give medication that fight those testosterone levels. That reduces those very high androgen levels within your system. So there are medications that can be given. And with these medications and the reduction of these high androgen levels, you find that the body begins to come back to its normal state. And once the body begins to come back to its normal state, your hair starts to grow back naturally. So there is treatment. And the key is to counteract these high levels of testosterone that are there within the system. Jeremiah says, nice presentation. This was timely. Thank you very much. Chabela Mzunga says, I would like to know more about how androgens are part of medical treatment for testosterone. So when it comes to androgens being part of the medical treatment of testosterone, what we're talking about usually are sort of the anti-androgens, because remember, when it comes to PCOS, you find that there is a very high androgenic environment that is there within the body. And also, you find that because of the impact of insulin, which also causes a very high level of androgens and causes your liver to stop producing a protein that carries these androgens, there's these high levels of androgens. So when you're talking about these androgens, maybe we're talking about these, they are sort of anti-androgen drugs in particular that get to reduce the androgen levels in the system. And as they go down, you find that your body begins to recover. The question for Rorty says, what could be the cause of having sharp pains near the uterus where it sits? That's a very, very loaded question. It's hard to say, because where the uterus is, it can be infections, it can be cyclic pain due to endometriosis. I feel like you'd really need a full evaluation for help to be given in that, because it feels quite loaded. Please try and reach out to us. If you can reach out to us, or go to your nearest healthcare center. Hannah says, can I find the presentation? Yes, this is a recorded presentation, and we will be able to put it on our YouTube channel, which is Womb Care Clinic. We'll load it from there. We'll load it to our Facebook pages as well, the link, so that you can actually rewatch it and share it with whoever Dean managed to log in. Biko Banda says, is having irregular menses without other PCOS-related symptoms a flag for PCOS? Thank you very much for that question. When it comes to irregular menses, it's not really a flag for PCOS itself. The menstrual cycle is controlled by a cluster of different hormones. So you find that hormones such as prolactin, thyroid stimulating hormones, that also do play a role in one's regularity of the menstrual cycle. Remember, when we're talking about how you make the diagnosis of PCOS, we spoke about having irregular menses, we spoke about signs of high androgens within your system, and then we spoke about the imaging aspect of things. And we say 2 out of those 3 should be able to come together for one to say this is a patient that is having PCOS. And as well, just obesity on its own, without obesity being associated with polycystic ovarian syndrome, can actually cause one to have irregular menses. So just having irregular menses alone, in as much as we can think PCOS, I think it also makes us think a bit wider, because there are so many other disease processes that can actually cause that. So it can be a small flag, if I can put it that way, in line with a good number of other differentials that we can have. But it's important that we get to look at other things that do control your hormonal side of things, and that do control your menstrual cycle. Linda Kalenga says, great work. Thank you very much. Chida Habuyo says, thank you for the nice presentation. I'm suffering from PCOS, and I must say it's not easy. I can only imagine what you're going through. And I think this presentation was meant for people like you to say, you are not alone. There is help out there. And I know it hasn't been an easy journey, but I think just to say you're not alone and there's help out there. Kakwashi Piri says, how safe is laser treatment during pregnancy? Are there any recommended for hair treatment that can be used throughout pregnancy? So when it comes to pregnancy laser treatment, it's not something that is very much advisable. And in terms of managing one's sort of hirsutism during pregnancy itself, you find that the options are very limited, more especially the medical options in terms of drugs. So because one is pregnant, you find that pregnancy itself kind of gets to slow down that particular hair growth that an individual is having. But it's also just important if you are uncomfortable with the hairs that are there, then just shaving, using hair removers, that is something that would be safe for you during that period of time until you get to deliver. Christine Shower says, educated topic. Thank you. What is PC? I logged it late. Ms. Shower, do not worry. This is a recorded topic. It will definitely be put up on our womb care clinic page, even our YouTube one. It will be put up so that you can watch it. So what it is basically polycystic ovarian disease or polycystic ovarian syndrome, which is this cascade of symptoms that comes together due to hormonal changes or hormonal imbalance that leads to a complication of diseases and symptoms that one can actually have. Mr. Kelvin Habuela says, hey, doc, sorry, I might have logged in a bit late. Are there any tests or procedures that can be done early to prevent PCOS? Um, Thank you very much for that question, Mr. Kelvin. And just as I was telling Ms. Shower, don't worry, you can watch the recorded version. Um, Unfortunately, PCOS is hereditary, so it means not much can be done for an individual to prevent them because it's something that is hereditary. And because of the complex nature of it, and we're not even quite sure, even in science, why it comes up, how it comes up. There are so many theories. There are not there are no tests that can be done for one to sort of get to prevent it from happening to them. However, what can be done is providing knowledge to individuals so that they can have an earlier diagnosis. And with an earlier diagnosis, that's when you get to manage the symptoms that are happening. And in terms of lab tests, of course, there are like AMH, anti-Müllerian hormone testing that can be done. You find that the luteinizing hormone, follicle stimulating hormone, and there are other hormonal tests that support the menstrual cycle that can also be done in order for one to have that diagnosis of PCOS. I joined in late. Sorry, that's Madam Dio or Mr. Dio. Are there foods that need to be avoided in order to manage PCOS? Are there specific medicines to regulate menses? I think that has been answered in the chat. Just avoid the sugar and the processed foods. Those definitely should be avoided. Why? Because those worsen the insulin insensitivity that one is having. They worsen the obesity that one has. The weight gain just keeps getting higher. So it becomes a challenge. And when it comes to regulation of menses, what we're talking about, and I hope you do get to watch the beginning of the video, is that number one, your cycle in a patient that has got PCOS is that it's full of estrogen and there's no progesterone. And those two have to work together in order for one to have regular cycles. So you find that hormonal treatment in terms of combined oral contraceptives, progesterone containing, those ones should help in terms of regulation of cycle. Thank you for the presentation. I was once diagnosed with PCOS between 22 and 25. How it resolved, God knows. Did several scans to monitor the cyst. That is absolutely lovely. And I'm glad you say God knows, but I'm glad you're doing well, and I'm glad that it's absolutely resolved. Angela says, I was diagnosed with PCOS early this year. I have irregular periods. As a TTC woman, I've been prescribed ovulation inducers. I do see my periods while on them. Does this indicate ovulation? I can't use ovulation testers because I have elevated LH and AMH. What would be your advice? Um, Sorry, first of all, that you're going through this struggle. I'm pretty sure now what you're trying to look for is to have a baby, if I'm not assuming wrong. And when it comes to the fertility side of PCOS, like I said, weight management, very important. Healthy lifestyle, very important, of which I'm pretty sure you're on it. So, does having your period mean that ovulation is happening? Yes and no. not every period is a ovulatory period. That is something that is very important to know. And remember, we're saying naturally the little bubbles, the cysts that are sitting in your ovaries are not growing to a size where they can actually ovulate. So if you're giving ovulation inducers in terms of hormones, the only thing that it's doing is trying to mimic a system where it appears as if ovulation did take place, so that there's a breakdown in the inside of the uterus. So it's important that if you're trying to conceive, there are still medical aspects of it where periods are started, ovulation inducers are started, and then you are followed up on very specific days to make sure ovulation is actually taking place and you're being tracked. So you can definitely be monitored. I think seek proper help with a gynecologist, have a sit down with them where they can draw up a proper plan, if possible, a fertility specialist, so that they can draw up a proper plan for you to monitor that. In terms of what medications can be used, I think that's been answered by Dr. Sekeleti, which says treatment is individualized. There's no one medication for all. Please seek guidance from your healthcare provider. There's a comment which says from Miss Nampasa Baleke, who's our sonographer at Home Care Clinic. From a sonographic point of view, transvaginal ultrasound shows fewer randomly scattered ovarian follicles and a normal-sized ovary or larger ovaries with 12 or more small follicles, and these follicles are between the size of 2 to 9 millimeters, arranged periphery, that is on the sides, and they get to look like string of pearls in appearance, and they are increased bright, which is biochoric ovarian tissue. So in a nutshell, as ladies, let's normalize doing routine ultrasounds. Thank you, Doc, for the wonderful presentation. Thank you very much, Ms. Nampasa, for even putting your medical input in there. Beko Banda says, thank you. Fatima K. Alba said, I was diagnosed with PCOS 2 years ago. The only symptom I had was balding, but my hair has grown back after getting some meds, but still having challenges conceiving, although my P's are very regular, and so is my ovulation. Congratulations, and thank you for your testimony. I think those are some of the testimonies that we need to hear from people. You went through a challenging point, and now you're doing well. I know there's still a part of your journey that needs to be followed up. And please remember, when it comes to fertility, even with individuals that have got PCOS, in as much as we would focus on the woman to say, okay, you've got PCOS, and I'm pretty sure this is where it's coming from, it takes two to tango. So it means even in that particular journey, your partner, your husband, your spouse also needs to be followed up. They also need to have their tests. So it's important that both are actually tested and both are actually followed through. We always have this rule in fertility where we say there's also that 10% chance that you just don't know what's causing the infertility. That is very important to know. So we can resolve all of these things, but there'll be that 10% somehow which just falls into this unknown period of time. So, Madam Fatima, please do not lose hope. And I hope one day we can have a woman like you on our Scars of Womanhood series, where we get to have a discussion about PCOS journey and just get to hear from people that have actually been through this journey. The link has been posted for our YouTube channel. Kay says, thank you for the great awareness. Looking at the challenges of fertility associated with PCOS. Can combined hormonal contraceptive pills worsen this? And how effective are they in regulating the cycles? Thank you for that question. Combined hormonal pills are contraception pills. So I did mention that when it comes to management, there are certain things that sort of crisscross. So somebody with seeking to have a baby, going on combined hormonal contraceptive pills kind of gets to crisscross, because you find that even a person that does not have PCOS, once they're on hormonal contraception pills, it means they're not planning on getting pregnant. So you definitely need to find the right balance between this, because it becomes quite a huge challenge. And in terms of them effectively regulating your periods, they're very effective in doing that. Why? Because they contain both estrogen and progesterone, which are the two major hormones that sort of have to strike a good balance for one to have these regular cycles. Kalua Thelma says, how often should one with PCOS do a full hormonal profile to monitor their status? It depends on what exactly you're looking for. I wouldn't say you need to be doing a full panel of your hormone tests, your LH, FSH, T3, T4 every year or every 6 months in particular. What is important is if you're on treatment, you find that that is when we get to monitor these particular hormones to see whether or not we're trying to induce ovulation or not trying to induce ovulation. Secondly, the most important thing is having your routine medical checkups because we know that PCOS can actually cause complications such as high blood pressure, diabetes. It can increase your risk of liver and kidney disease. So those are the important things that you need to check. So checking your sugar levels in terms of their control every 2 to 5 years is very important. Checking your high blood pressure even on a monthly basis is something that is important. Checking your cholesterol levels, which forms part of your liver function, twice in a year is something that is more important than the actual hormonal status of your body. How can you know what type of ovulation they're having if they are TTC? I think I'm a bit lost on TTC. I think I've heard it somewhere before, but yeah. So in terms of type of ovulation, there's really no types of ovulation. It's either you've ovulated or you haven't ovulated. And when it comes to ovulation, there are clinical signs that are there with ovulation. Midway through one cycle, there's a thinning of the mucus that they're passing. At the time when they're having their periods, there are these Molimina type of signs where there's mood swings, breast tenderness, all of those, which kind of speak to ovulation. And there are also blood tests that can be done to see whether you're ovulating or not. And these have to be done at the appropriate time. Hope says, beautiful work you're doing. Have controlled my acne and weight through exercise and diet. That is absolutely great. But my observation is that I have regular periods for 2 months. Then the following month's period come after 42 days, especially when my sugar intake is too low. Why? First of all, pretty awesome that you've actually controlled your sugar. Dr. Chivesa Sekeleti has thrown in your answer to your question. She's one of our consultants at Home Care Clinic. She's an obstetrician and gynecologist, a wellness specialist as well. And that is sort of her field and says typically increased sugar and processed carbohydrates cause menstrual disturbance. The better course of action would be to do a checkup that helps to narrow down the issue. Diet is the cornerstone of balancing. Sister Takuzo says, very educative. Thank you very much. Thank you for always logging in. Kalizia Nanda says, a huge emphasis on the need to adopt a healthy and active lifestyle to manage hormonal disturbances brought about by PCOS, which is from our womb care wellness. Kay says, thank you. Nella says, I was diagnosed with PCOS last year. I have regular light periods that last 4 days. My biggest worry is the cyst. Whenever I miss a period, then I have a cyst growing. The largest has been 9 millimeters. I'm sorry about that, Nella. Cysts are a part of PCOS, and you're right in terms of the size of the cyst. In terms of the size of cyst as well, that can be quite worrisome in terms of it tossing or turning. But 9 millimeters is very small, so that shouldn't be a worry in terms of 9 millimeters. So 9 millimeters is a size of a cyst within the follicular period, which is the first part of your period before it even becomes a dominant one. So that's okay. Is insomnia a normal symptom for PCOS? So PCOS does cause a derangement in one's hormones in general. And because of this particular derangement in one's hormones, you find that there might be derangements even in your dopamine levels, and that can actually affect your sleep. So it's not a common symptom, but it can be part of the symptoms that can be there. Violet says, thank you very much, Doc, for this great and educative presentation. And I think that was the final comment or question that was there. Dr. Chibes has just thrown in something there, which says sleep is controlled by another hormone called melatonin. In general, with hormonal disturbance, one affects the other, so it's definitely possible. Thank you very much for that support, Dr. Sekeleti. So I think thank you very much to everybody that got to log on. Thank you very much to everybody that is watching this particular presentation recorded. Feel free to always post your comments in our home care page on Facebook, Instagram, TikTok, or even on on our YouTube space. So thank you everybody that logged in, and I hope this has been helpful. Remember to always seek medical attention that is personalized for you. We might be having the same disease process, but it's affecting us differently along the way. So that is why treatment should always be personalized to each individual. Thanks a lot, and wishing you a very, very lovely, lovely week. Yeah, have a great week, even as we count down to summer.